Hi, my name is Benesi Usman. Today, I will going to discuss a case study of cortical color blindness with relative intact achromatic discriminations. The following are the authors of the case study. The case report is CB is a 28-year-old highly educated man who performed documentary research for the civil service. In August 1984, he was involved in a road traffic accident. He was conscious but confused on admission to hospital, and there were no severe immediate neurological deficits. However, 18 hours later, his conscious level deteriorated and the right pupil became dilated and fixed. He withdrew to pain on the right side but had a left hemiparesis. At this point, the patient appeared to be blind. Perception of light in either eye returned over the next few days. Both optic discs showed pallor and there was ptosis on the right side. The right pupil was still dilated but now responded sluggishly to light. The right pupil was still dilated. Right second and third nerve paresis together with cortical blindness were found. His vision improved over the next few weeks until he could read the letters in newspaper headlines. A repeat CT scan showed no evidence of the occipital abnormalities, which were therefore thought to have been caused by infarction and arterial compression. He was discharged home 4 weeks after the accident. In January 1985, he was admitted to the Rivermen Rehabilitation Center for assessment and treatment. So these are the detailed the testing was initially carried out from 6 to 8 months after the accident. First, the visual fields, dynamic perimetry carried out on 11 occasions between 5 and 6 months after the accident revealed a stable pattern of visual field loss. The next is the visual acuity. 5 months after the accident, snellen acuity in the left eye was 6/24 and could not be improved with lenses. With the right eye only, finger counting was possible. The next test is visual shape perception. CB was tested on visual shape perception using a task of EPRON 1. The task requires the subject to discriminate a square from a rectangle that is matched for total flux. The next test is face recognition. The patient is reportedly no difficulty in recognizing the faces of friends, but disturbances of color vision following cerebral damage are frequently accompanied by impaired recognition of previously known familiar faces. The other test was conducted was color perception. CB had no difficulty in naming the color of common objects from memory, but was grossly impaired when asked to name the colors of objects which he was confronted or which lay in his immediate surroundings. He described his surroundings as being darkly colored as in an unlit room at twilight, even when they were bathed in sunlight. Formal tests of color vision were presented from 7 to 9 months after the accident. The results indicate that this color vision is markedly impaired relative to that normal observers. There is perhaps a suggestion that he experienced the greatest difficulty in the discrimination of views falling in the red, yellow, green part of the spectrum. And the last test conducted, the ordering of Munsell color swatches. The results largely confirmed the findings reported above when asked to name the color of the different Munsell series. Steve described reds and the yellow-green as orange and pale and orange, respectively the blues as reflectance of saturation. And that would be all. Thank you.